Well, millions of people in the United States live with eye conditions that can cause blindness if they're left untreated. Age-related macular degeneration, also known as AMD, is one of the most common causes of vision loss later in life. Joining me now is Dr. Michael Amar, ophthalmologist at Retina Consultants of San Diego. Dr. Amar, thank you for joining us this morning. First, can you kind of just tell us what age-related macular degeneration is, and really who does it tend to affect? Is there a certain age limit? You know, you get past this age and that's when we start to see it. No pun intended.
Yeah, well, good morning and thanks for having me. Age-related macular degeneration, or as we call it, AMD, is a medical condition where there's progressive damage to the nerve tissue of the eye, an area we call the retina. More specifically, this damage happens to the central part of the retina, the part that's most critical for our vision, an area we call the macula. And wet AMD is a more aggressive, advanced version of this disease process that can result in more significant vision loss, but now more than ever is a very treatable condition, especially if caught early. So I'm partnering with Genentech to help raise awareness for AMD and the importance of eye health and eye screenings. You asked, is there a population that tends to be more at risk, or a population that tends to present it most commonly? We know the biggest risk factor for AMD is age. So the older we are, the higher likelihood that we might develop AMD. That risk is around 1 to 3% in our 50s, but in our 70s can be as high as 20 to 30%. Family history and genetics is another large risk factor, and there are some modifiable risk factors that we can control, like high blood pressure, obesity, smoking. These are things that are within our control.
Yeah, and I guess the older that we get, obviously we just sort of expect some vision loss, or things are going to look blurry, or maybe we need readers. So then how do people know the difference between that and what may be the beginning stages of macular degeneration?
It's a great question. And the reality is sometimes we don't know. As a patient, it's hard to tell if my blurred vision is from glasses or something else going on. Really, the best way to check is to get a dilated eye exam with an eye doctor. And an annual eye exam is something we feel very strongly about, to look for early signs of macular degeneration, to keep that on our radar. There are sometimes some features of the vision loss that can lead a little more towards macular degeneration. If there's more distortion in the vision, or if people are having a harder time with their night vision, these can be other indicators that maybe there's something more going on than just glasses, but really just critical to get an eye exam to know for sure.
Yeah, don't skip those, especially the dilation ones. I can't stand those. You can't do anything for hours afterwards. But what are some current treatment options if people do go to the doctor and determine that they do have macular degeneration? What can you do about it?
So wet AMD, or wet age-related macular degeneration, is typically treated with an eye injection. Now, every time I say that to my patients, I get the same reaction, a grimace, a little squirm in the chair. But the reality is it's a completely painless procedure. There's no discomfort at all, and very safe. One treatment that exists is called Vabysmo, or faricimab. It's an FDA-approved medication for the treatment of wet AMD, and has shown to be very effective in preserving vision and showing durability, which means maybe fewer injections for patients over time. And this medicine has been shown to preserve vision.
Because it's something that you would need to continue to go back and get those injections to keep up with your deteriorating vision. Correct.
And some patients in the past have had to go as frequently as every month or every 2 months. But as we get newer and better medications, we're seeing increased durability between injections, which hopefully means fewer visits and fewer injections, while providing the same amount or more of vision preservation.
All right. So my ophthalmologist, my eye doctor, should know about these new treatments?
Absolutely. I encourage people who have AMD or at risk or just want to learn more to speak with their eye doctor, even sometimes their family doctor if they need a referral. And the eye doctor should be very well informed of these medications and discuss if they are, in fact, a good option for a given patient.
All right. Dr. Amar, thank you so much for your time today. We appreciate you coming on and explaining, because it's a really important subject.
Thanks so much for having me. Have a great day.
You too.